International humanitarian organizations. 1. Overview of major humanitarian organizations. Red Cross, UNHCR. Major humanitarian organizations play pivotal roles in responding to crises, advocating for human rights, and promoting sustainable development worldwide. International Committee of the Red Cross, ICRC, and the International Federation of Red Cross and Red Crescent Societies, IFRC, are renowned for their neutral and impartial assistance in conflict zones and during natural disasters. They provide medical care, support for refugees, and work to uphold international humanitarian law. B. The United Nations High Commissioner for Refugees, UNHCR, focuses on protecting and assisting refugees, internally displaced persons, and stateless individuals. It works to ensure their rights and facilitate durable solutions, such as resettlement or voluntary repatriation. C. Médecins Sans Frontières (MSF), or Doctors Without Borders, delivers emergency medical aid in areas afflicted by conflict, epidemics, and disasters. Their commitment to impartiality allows them to operate in some of the most challenging environments globally. Oxfam is dedicated to alleviating global poverty and addressing inequality. It provides disaster relief, supports long-term development projects, and advocates for fair trade and social justice. Save the Children focuses on improving the lives of children through education, healthcare, and protection from exploitation and abuse. They respond swiftly to emergencies, ensuring children receive the necessary support during crises. The World Food Programme, WFP, is the leading humanitarian organization combating hunger worldwide. It provides food assistance in emergencies and works to improve nutrition and build resilience in vulnerable communities. UNICEF, United Nations International Children's Emergency Fund, advocates for the rights of children, offering support in education, health, and emergency relief to ensure every child's well-being. Amnesty International champions human rights by campaigning against injustices, advocating for legal reforms, and raising awareness about violations globally. ICARE International focuses on fighting global poverty and providing disaster relief, with an emphasis on empowering women and girls as agents of change in their communities. The World Health Organization (WHO) coordinates international health efforts, addressing public health emergencies and promoting global health standards and policy. These organizations, through their diverse missions and extensive networks, collaborate to address the multifaceted challenges facing humanity, striving to create a more equitable and resilient world. 2. Roles and activities in humanitarian assistance, disaster response, and refugee protection. Humanitarian assistance, disaster response, and refugee protection are critical components in addressing crises and ensuring human dignity during emergencies. Each area encompasses distinct roles and activities that collectively contribute to alleviating suffering and rebuilding lives. Humanitarian assistance. Humanitarian assistance focuses on providing immediate relief to populations affected by conflicts, natural disasters, and other emergencies. Key roles include provision of basic needs, delivering food, clean water, shelter, and clothing to affected individuals, healthcare services offering medical care, disease prevention, and mental health support to maintain health and well-being. education and protection, ensuring access to education for children and protecting vulnerable groups from exploitation and abuse. Logistics and supply chain management, coordinating the distribution of aid efficiently and effectively to reach those in need. B. Disaster response. Disaster response involves rapid and coordinated actions to address the immediate impacts of natural or man-made disasters. Essential activities include emergency preparedness and planning, developing strategies and plans to respond swiftly to disasters, minimizing loss and damage, search and rescue operations, locating and saving individuals trapped or injured during disasters, infrastructure repair and restoration, rebuilding essential services such as water, electricity, and transportation to restore normalcy, coordination and communication, facilitating collaboration among various agencies, governments, and organizations to ensure a unified response. C. Refugee protection. Refugee protection aims to safeguard individuals fleeing persecution, conflict, or violence, ensuring their rights and well-being. Core roles and activities include legal assistance and advocacy, providing legal support to help refugees navigate asylum processes, and advocating for their rights at national and international levels. Safe shelter and relocation, ensuring refugees have access to secure housing and facilitating their relocation to safe areas or third countries. Integration and support services, assisting refugees with language training, education, employment opportunities, and cultural integration to help them rebuild their lives. Monitoring and reporting, tracking refugee movements and conditions to inform policies and improve protection measures. D. Collaboration and coordination. Effective humanitarian efforts require collaboration among governments, international organizations, NGOs, and local communities. Coordination ensures that resources are utilized efficiently, gaps are addressed, and aid reaches those most in need promptly. E. Advocacy and policy development. Advocating for humanitarian principles and influencing policy development are crucial for creating environments that support sustainable assistance, disaster resilience, and robust refugee protection frameworks. Together, these roles and activities form a comprehensive approach to managing crises, protecting vulnerable populations, and fostering recovery and resilience in affected communities. 3. Challenges and coordination in humanitarian operations. Humanitarian operations face numerous challenges that can impede effective response and aid delivery. Logistical challenges transporting supplies to remote areas. Conflict-affected areas is often hindered by poor infrastructure, limited access, and unpredictable environments, delaying essential aid. B. Security risks. Humanitarian workers may operate in volatile regions, with threats of violence, kidnapping, or instability, compromising their safety and the continuity of assistance. C. Funding constraints. Limited and unpredictable funding can restrict the scope and scale of operations, making it difficult to meet urgent needs and sustain long-term projects. D. Coordination complexities. Multiple organizations, including NGOs, governments, and international bodies, must collaborate efficiently. Lack of coordination can lead to duplication of efforts, gaps in aid, and inefficient resource use. E. Political and bureaucratic barriers. Navigating differing regulations, gaining access, permissions, and managing political agendas can delay interventions and limit operational freedom. Cultural and language barriers. Understanding and respecting local customs and languages is crucial for effective communication and program implementation, yet often poses significant challenges. G. Data management and communication. Reliable information is essential for decision-making. Inadequate data systems and communication infrastructure
can hinder timely and informed responses.
Hey, ensuring impartiality and neutrality. Maintaining trust and neutrality is vital, especially in polarized environments, to ensure aid reaches those in need without bias or politicization. Coordination strategies. Centralized platforms establishing unified coordination bodies, such as the ONS cluster system, to streamline efforts and facilitate information sharing. B. Partnerships and collaboration. Fostering strong partnerships among stakeholders to enhance resource pooling and strategic planning. C. Standardized protocols. Implementing common guidelines and best practices to ensure consistency and efficiency across different organizations. D. Capacity building. Strengthening local organizations and infrastructures to improve responsiveness and sustainability of aid efforts. Addressing these challenges through effective coordination and strategic planning is essential for enhancing the impact and efficiency of humanitarian operations. 4. Globalization and international humanitarian organizations. Globalization has profoundly shaped international humanitarian organizations by enhancing connectivity and expanding their operational reach. Increased global interdependence allows these organizations to respond swiftly to crises anywhere in the world, utilizing advanced communication and transportation technologies. This interconnectedness facilitates resource mobilization, enabling the pooling of funds, expertise, and materials from diverse regions to address emergencies effectively. Furthermore, globalization promotes collaboration and partnerships between international and local organizations, fostering knowledge exchange and capacity building. It also allows for the integration of innovative technologies and data-driven approaches in humanitarian efforts, improving efficiency and impact. However, globalization also presents challenges. Organizations must navigate complex political landscapes, cultural differences, and varying legal frameworks across countries. The rapid spread of information through global media can heighten scrutiny, demanding greater transparency and accountability. Additionally, the scale and frequency of global crises, from pandemics to climate-induced disasters, require robust and adaptive strategies.